the body mass index, which is the traditional tool that we use to screen for obesity. It's commonly misused really to diagnose obesity, but it is a population-based tool that was developed actually in the 1830s, right? And has been adapted now in the 20th since the 20th century and is used to define where the threshold for obesity is, how we decide what medications we're going to use. But a lot of the recent data has shown that it does have both age bias, gender bias, biological sex bias, racial, ethnic bias. So, especially when it comes to Black women, how do we talk about this when the very tool we may be using may be either what it tends to do, at least from the research that we've seen by Dr. Fatima Cody Stanford and others, is that for Black women, our BMI threshold of 30 tends to overestimate. So we're trying to get people to be too small. Very controversial.
The BMI, it is absolutely a flawed representation of body composition. And so I tell patients all the time, I say, listen, especially for my athletes, right? Because we know they're going to have a bunch of muscle mass, that it will likely be much higher in you. But what we're going to do is not focus on just this sole number. We're going to take a comprehensive approach and just use it as a way to track and measure some weight loss. So with that being stated, we know that it's just a simple calculation using the height and the weight, but it's not taking into consideration muscle fat and your body deposition or your bone density. So we have to just make sure that we're communicating effectively to the patients and saying, hey, this is just a basic guess of the body composition of your body. And it's one of the resources that we have to kind of drive your treatment and your management. But it's not the only thing that we're going to use, because there are other risk factors such as diabetes, hypertension, your numbers, cholesterol, all those things, mind, body, and spirit, which can affect your ability to achieve effective weight loss.